afternoon. So there's a very common question which is asked to me is, kya the incidence of infertility is rising? What has happened in the last 15 to 20 years? What has happened in my practice? And I very much say what my patients say as well, कि मैम infertility का incidence बढ़ रहा है. And I would say yes to it. There could be two, three reasons for it. One could be that we have better technologies to diagnose it. हमारे पास blood test अच्छे आ गए हैं. We have high resolution ultrasound machines. We have sperm checks which are done in a very nice way. So maybe we are kind of a better equipped to diagnose infertility. And second, I would say that awareness. A lot of patients in the past would never come and seek the treatment for infertility because it was a social stigma. वो शायद अभी भी है, but पहले ज़्यादा था. So they have infertility, but they would not come and talk about it. अभी क्या है कि if any couple is trying for pregnancy, even for 3 months, 6 months, they get concerned. They come and walk to us and say, ki, please check me, why it's not happening. So maybe I would say awareness. तीसरा important question जो हमेशा debate में चलता है कि have our lifestyle or living practices changed? And I would say a lot, yes. Our living practices have changed. We have become more stressful. We have become more pressurized. Not only because of the fast growing life, but also because of the way I think we work. I get a lot of patients जिनकी की companies बाहर की हैं, the international world, but they work in India. So the timings of working and sleeping is altered. Because if the body clock is altered, that can also affect infertility. So the lifestyle factors are changing. The other thing is we are much more driven these days with our work that we forget to walk, we forget to do yoga, we forget to do meditation. All these things are very important because they, at some time in your life, they do help to increase the vascularity of the body. And we know that vascularity of the body is very important for every cell and organ of the body. And pregnancies is in pregnancy also we need that. So I would say that yes, lifestyle. The other part of lifestyle is the food. We are very much now open to having foods from outside, which is fine. I think we have very good restaurants and joints which provide us with healthy food. But having said that, eating every day out and eating the tinned and the canned foods also have preservatives, which may prevent in some way or the other our health issues, our cells of the body. So overall, if I have to say, what could be the reason for increase in the infertility in the last 15 to 20 years? I would say yes, increase awareness. We talk about it more. We have better equipments, tests to diagnose it. And lastly, our lifestyle changes, our work practices changes could have been the responsible factors. I am Dr. Puneet Rana Arora. I am a gynecologist and a reproductive medicine specialist. I am the founder and director of CIFAR, which is Center for Infertility and Assisted Reproduction based in Gurgaon. I have more than 20 years of experience in this field. I did my post-graduation from India, and then I worked in National Health Services in UK, United Kingdom, for more than a decade. And with a view, I came back that I want to provide my patients ethical and evidence-based clinical practice to my patients, where I can advise them rightly and raise the awareness of achieving pregnancy at the right time. The other change in practice I would say I have seen in my clinic is the rise in the mental health status. And I wouldn't say abnormalities, but rise in the incidence of anxiety and stress in our practice. We at CEPHAR have a very good practice of assessing our patients, doing a scoring system when they come to us for the first time, so that we know what is their baseline mental or psychological health status. Because if we know the baseline, we know how to target and what to target. So we give them a questionnaire to fill it up, which helps us to see how much depression, how much anxiety, and how much stress they have within themselves. And then if they score high on that, then we try to give them a specific questionnaire to see whether this stress is infertility induced or is it just for some other reason. Again, this also helps us to delineate and highlight the pathway or the treatment pathway for them which is catered to them. If it is related to infertility, our psychologists are very well trained here and they deal with it. If it is a stressful situation because of work, home practices, or something else, then we kind of tell them to see a psychologist who deals with such situations. So I would say that mental health has also seen a change in our clinic since the last 15 to 20 years.